And welcome uh, to the joint meeting of the Health and Human Development Committee and the Human Services Board. Chairman Trottier is not available tonight, so he asked if I would chair the meeting. And the secretary of the committee, Supervisor Spencer, is up here with me. And we do have a quorum of the committee and we do have a quorum of the board. So welcome one and all. For item number 2 on our agenda, we have the youth and governance statement. And is Ignacio isn't here yet? Okay. So, and Tria is not either. So we'll just suspend with that and unless and until they come. And we'll move on to item 3, which is public comments. Are there any individuals in the audience who wish to give public comments to the committee and board? Hearing none, we will move on to item 4, which is approval of the minutes from May 11th, which was a joint meeting of both bodies. And a motion to approve would be in order. And I think we're going to need 2 separate motions, one from the committee.
So move.
Okay, is there a second? I'll second. Okay, we have a motion and a second from the committee and a motion and a second from the board. Okay, Supervisor Meyer moves. Is there a second from the board? And Ms. Dankulovich seconds. So, just perfect timing. Ignacio's here, but we'll continue with our motions on the approval of the minutes. Are there any corrections or points of discussion for approval of the minutes? Hearing none, I will first ask for the committee to vote, and that would include youth and governance. This is approval of the minutes. Youth and governance in favor? Thank you. Committee members in favor? Aye. Any opposed? Board members in favor? Any opposed? Both bodies have approved the minutes. Item 5 is a report from the county executive making reappointments to the Human Services Board. And this is information only because at the last county board meeting, the board, knowing full well who the nominees were, namely Supervisor Trottier and Supervisor Meyer, did unanimously confirm their reappointment to the board. So that's just for all of you to be aware. Now, I'm going to ask indulgence. One of our members has another, one of our presenters has another commitment. So I'm going to ask that we take at this time item 10, which is an economic support division update. And I would like to welcome the distinguished Crystal Ellis, who was also a student when I was principal at St. Catherine's. And we have a little joke because when I became principal, we had a theme for the year, which was to pursue excellence. So ever since that time, which was a few years ago, we mentioned to each other that we are both pursuing excellence. So welcome, Crystal. And Crystal Ladis, our Deputy Director, is here, and she will give a little introduction.
Thank you. Thank you, Mr. Chairman, and thank you for adjusting the agenda for us. So as the Administrator of Workforce and Supportive Services, we are excited to share information. There's a lot going on in economic support with all of the federal changes. And then we have Melvin Hargrove, who is doing workforce support and outreach, community outreach. And is here to share some of the results of his outreach and share with you what he's been doing. And Liam Doherty, who oversees, not represented here, he oversees workforce. And we have a couple other members in the audience who do a lot of the work in our workforce area. He also oversees our Veteran Services Office and the building at Taylor Avenue, which has a lot of needs. And so he brings his experience in building and facilities. So his duties reach far and wide. But we're excited to share some information, and please ask any questions that you may have. And I'll turn it over to Crystal, our manager of economic support.
Hello, everybody. I'm guessing that's not gonna switch. It's okay. No, can you go down? There you there. Oh, it's all right. I have it right here. Okay, there you go. So Act 116 is a new funding strengthens SNAP quality insurance. What it does is the stated goal is to maintain a payment error rate under 6%. That's the new federal laws that is being in place. So what they're going to do is they created this pre-certification tool, also known as a PCR tool. And what it's going to do, it's going to QC, which is quality control, a lot of cases throughout Racine County. As of right now, for us, we receive 2,000 food share or some type of intake application monthly. With this funding, they expect us to have 25% done each month. So that's basically like 500 a month. So we're going to create positions in a new unit to build off of this. They're going to give us the funding for Racine County. We get $400,000 for that, but it's just a certification tool to make sure that our staff is doing things right on the cases, which is CARES Workers Web, and making sure everything is correct. We already have our own in-house policy, but this is going to it's going to expand on what we already have. Does anybody have any questions about Act 116? Okay. Also for our staff right now, we currently have one vacancy that is subject to change all the time. We have a high retention rate, but we always train right away. So right now, as of now, we only have one vacancy. We want to have a new position in January of 2027 for the ADRC, the Aging Disability. What we want to do is we want to put a lead out there that's a part of the elderly, blind, disabled, and long-term care unit. They're going to be stationed out at the ADRC and help them with all of their extreme cases that need to be fixed right away. Right now, we're just getting emails, but there are a lot of them. So we want to actually just put someone out there. And with all the new Medicaid updates and requirements that are starting in January, this would be very beneficial to us. As some of you may know, once the new requirements for Medicaid come in, the work requirements, 63,000 people are subject to lose their Medicaid starting in the beginning of the year. We right now, and this is Wisconsin total. We don't have the numbers for Racine County yet, but they expect 63,000 throughout the entire state. With all of these work requirements, meeting the 18 to 64 limits for medical, just to make sure you have it. If you're for the work requirement, you either have to be working, volunteering, or some type of paid status, 80 hours a month to still receive medical. We did that a while ago with SNAP, with the food share employment and training. So it's basically under the same requirements. Luckily for Wisconsin, we don't have to meet the 6-month recertification every time. Other states do. We only have to do it yearly. So that does help us, but it's going to be a big workload knowing that a lot of people are going to be affected by this.
You do have a handout in your packet that talks about Medicaid and SNAP dates and what is going to be happening. Some things have already gone into effect, and then it carries over into 2027. So it's just kind of a cheat sheet with all of the things that have happened with the federal legislation as of last July.
I think Crystal is open to questions at any time, so if you do have, just let us know.
You guys have the funding for the ADRC position?
Could I ask whoever is speaking, just use the microphone and you would press the right button, because we are broadcasting, and it works better if the microphone is very close to you.
Do you guys have the funding for that position?
Not as of right now, but the funding will come. That is the plan. That's why we're bringing it up now, so you guys can understand before January hits. That's what we want to add. Thank you.
And I apologize for me not knowing more about this, but what does SNAP stand for?
It's not stamps, food share.
Okay, all right, thank you.
No worries.
There are no bad questions.
Yeah.
Thank you, Chairman. Just a quick question on, you said the funding sources that you're planning on. Do we have an idea? Is that just going to be a budgetary item? Is that going to be a shift in position? And the only reason I'm asking is because that's what's going to be, those questions are going to come from the county board as well, as far as. how
Are you
that's-
asking for Act 116?
No, it's for the ADRC.
Okay, that one, yep, I was gonna say.
Yeah, so the good news with Act 116 are that funding is fully coming from the state. For 2 years, we also anticipate that it will likely continue. That is everything we're getting from the state as of now. So that's those 4 positions. As far as the ADRC lead position, that would be funding that would be braided between the Behavioral Health Services, ADRC, and HSD. So we'd be combining funding for that position because it's so critical. We're seeing our population age at a rapid pace. We are seeing a lot of high needs right now and cases that need that, as Crystal Ellis said, immediate attention. And we don't have the staff to get that immediate attention. Things, for example, where someone is in the hospital and they may lose insurance benefits and we need someone to process that immediately. Or there is a lawyer involved because the case is so critical and a family member may be disabled and there is some disagreements within the family and we need things processed immediately. We're seeing more and more of those cases and need someone not only to advise ADRC case managers who are working directly with individuals in the community or on their caseload, but also to help process those immediately.
So understandable, but just a question, if I may follow up, just if that's something that we can, is that expect possible grant opportunities for fund that position, or is that just going to come from a levy?
It'll be a combination. So within ES, 50% comes from income maintenance, which is a grant. So 50% of the position will automatically be covered.
Thank you.
And so did you have any more information for us, Crystal? Oh, okay. Any other questions for Crystal? Supervisor Spencer?
Thank you. Crystal mentioned 400,000. Is that's coming from the state as well?
That is, yep, just over 400,000. We should be getting it. It's the contract, WKRP consortium. So we're in a consortium with Kenosha, has been granted over 800,000, and we have 55% of that will come to Racine County.
All right. Well, thank you for the information. It was a lot of good information, especially to be aware of what's coming next year. So thank you.
Albert?
Good evening. I'll be sharing with you from the community outreach and engagement. So you can go to the next slide. Thank you. Real quickly, when County Executive Malicki took his post, one of the things he wanted to do was he wanted to try to make sure that we could bridge the east-west or the east-west divide. And his focus has always been on how can we bring the west end and the east end together so far as what's happening. And so part of my job is to make sure that we got information out to the west end as well as the east end. So you're going to see kind of a mixture of things here because you have kind of executive vision with that, but then you also have Director Otto's vision of also making sure that what Human Services is doing, make sure that we have access out on the west end as well. So I've been out there. If you see the 3 checks, increasing awareness of Human Services Department, doing a west end focus, and then also targeting churches, nonprofits, and food pantries. With that, we did you see the community feedback. We did a survey. We're still doing some of the surveys. The survey was really about, okay, what is HSD? Are we the access? Are we being accessible out there? Are we being impactful out there? If not, why not? And if so, then what does it look like? Is it good, bad, indifferent? And so this community feedback says 84% service awareness. So they were aware of the services out west end. 78% was confident in the staff. when they did interact with them. But I will say though, one of the things that we did realize and find out is that even though we have been communicating out west more and more intentionally, we're finding out that actually there are more who really don't know all the services that HSD is providing. And when you say, when we start talking about the services, one of the things they say is, okay, now economic support or SNAP. They know that right away, but they don't know about the ADRC, they don't know about the veteran services. And so it's been a real great help with that. I've been going back and forth we visited churches, we visited nonprofits, we visited the veteran services out west as well as east, just trying to make sure that we get the information out as to what Racine County has to offer as a whole, and then more directly human services. The other part of the vision is actually Director Otto's vision. That is, when you see the Employee Improvement Task Force, she's also real big on getting feedback from the employees, trying to create a better work culture within HSD. And so we've been able to lead the Employee Improvement Task Force. You can see as employee-led improvement initiative, enhancing service and efficiencies, strengthening communication and culture. What all that simply means is this: that we meet every other month, and we have conversations with a select group of employees, the task force, to finally get their ideas as to what's going right, what's not going right, and then we are able to then take that back to Human Services cabinet, and then share with them what's been shared with us, and then they share with us to share back with them, so that we can try to improve on the work culture within Racine County as well. It's been huge, and I've heard nothing but and received nothing but positive remarks or positive feedback from those participating as well too. So that's kind of in a nutshell what we're doing right now. Again, just east-west connection. Oh, thank you. Yeah. In your packet, you're going to see a handout. It'll simply say Human Services Department. Just call. We'll guide you. This is something we've handed out again, West End, and then also we've handed out East End. I've attached it to probably an email list of about maybe 60 churches within the East End as well. So we're trying to reach out to all the churches. We went to food pantries. We've gone to nonprofits to share what the human services are doing, but also we were sharing that survey as well too. So what you see is simply a one pager, and it tells you all the services. And the just call will guide you. And basically it gives a number for each service that is represented in human services. And we've had great feedback from the various churches we've talked to, and also the various nonprofits who literally are handing these out to people that come through their doors. So they said it's been again, when I say they, the people we've talked to say that it's been very helpful, extremely helpful to them to be able to give this out to people so that they can, know what's going on. Just a real quick point. We were out in Burlington. We were at the library out there, and found out that they literally are serving homeless people out of the library, feeding them, giving them a place, even sometimes to just kind of hang out. And so we've been trying to figure out how we can connect, what Burlington is doing out there with what we're also doing here at Racine Library as well too. But that's just one example of knowing or not knowing what all is going on out in Burlington. But right now they literally are, it's a food bank. So they literally are giving away food and giving away clothing, and then giving them a place to shelter for a little while during the daytime. So.
Brenda?
Does the county still operate the satellite office out in Burlington?
Yes, we do.
How,
Go ahead.
okay, my follow-up to that was then how well known is that office? And
That's
you're
good
smiling.
question. That's a good question.
Okay.
It's not well known. Everybody still remember the old office. And so as we're sharing with people, we're sharing with where the office is, and we have to share. We have to tell them, hey, it's by the Starbucks out there, or it's by the Domino's, in in the area. So it's anecdotally, I would say maybe about 50-50 of the people that we talk to, some will know and some won't know. Yeah. The other thing, real quickly, before I sit down, I want to also just kind of share with you about an initiative that county executive has also started with some of the pastors on the east and the west end as well too. And that's part of that is really trying to, again, bridge the east and the west. And so we've been meeting with some pastors on the west end and some on the east end, just trying to build relationships, just trying to figure out what can we do organically, try to bring both sides together as well too. So that's been going well, and we've been meeting monthly, and we're looking at trying to do some things organic, like maybe a service or something together, so that people understand that it's Racine County, it's not east or it's not west. So we're in the process of doing that as well too.
Thank you. Any other questions or concerns for Pastor Hargrove?
Okay, so you got 321 survey responses, which sounds pretty good. How many did you,
We're still doing them.
oh, okay.
Yeah, we're still doing, and what we wanted to do is we want to target like the food banks, wanted to target the nonprofits who are actually helping people. So that's why it's still a low number, and that's probably half east, half west of the eye.
Okay.
So it's our intention to the next time we come back to you to actually have even more than those responses.
So you're reaching out to organizations like one at a time or
Yeah.
within the organization? It's not a widespread survey that's being put out there for anyone else who might be.
Oh, it is, but we were trying to go where we knew like a big group of people would be at one time.
Okay.
Like for instance, we were at Love Inc. and
Gotcha.
they were serving, and then we went to Salvation Army when they were serving, and then we went to what is it? St. Vincent Paul community church out in Waterford when they're serving. Many of them have food banks as well, and so we've asked them to use the food banks to distribute the surveys.
Okay.
Now, if you have any ideas, I'm open to it.
Well,
I'm
all right,
listening.
all right.
So, and if not, I think everyone has my number. If you have any ideas on other places that we can actually reach, please let us know as well. We'll still be hitting the hospitality center as well.
Oh, because that's what I was thinking of, like if it can be like if you're hitting the community broadly or one at a time hitting organizations.
Yeah. Well, we're doing it
Because,
simultaneously. Yeah.
okay, hospitality center would be
Yeah.
big, I think.
Yeah,
we
we
could get response.
we talked to Joan, and she was saying that there's a certain time that it's best time to go.
Yeah.
And so we'll definitely be hitting them up again.
Okay. My other question is less important. What are those people holding in their hands on the picture?
You want to tell them what they're holding? They're holding kazoos. Because Tom, in his other life, he was a kazoo master. And so he started a kazoo band. And so this is one of the sessions we were having with the Employee Improvement Task Force. And so he taught them a song on the kazoo. And so they played the kazoo. And Miss Kristen later, she was kind enough to go purchase the kazoos for everybody to have one.
It was a hit. I was gonna say it.
Yeah, it actually, to my surprise, it was. I haven't played one or two tunes. That's about it, though. Yeah. So, and again, as I take my seat, that what's been pleasantly surprising to me is how the group, the task force, has really caught on to what we're trying to do, and are actually not skeptical, but it's more of a positive, and there's an expectation that they now have that they're going to be heard. So hats off to Director Hope and also to Kristen on that.
Thank you.
Supervisor Meyer, I think he has a question.
More like a statement, but I just want to say thank you, Pastor and Mr. Roundhouse, for going out and making those connections, and with the the amount of people that you guys can connect with, I think it's going to be very fruitful in the future. So thank you for what you're doing.
Thank you.
And I just wanted to add, if I could, that these are the survey, the feedback, as well as the employee task force. These are parts of our strategic plan. So these are things that we're looking at as measurable. We want this input. I feel like, Jody, I'm going to get you a kazoo. I see it. But these are things that we are very dedicated to and will be continuing to work on throughout the year. So I'd like to bring up Liam Doherty, our manager of workforce.
Hello, good evening. If you would, yes, workforce development. When people think of workforce, we tend to think of unemployed people, residents. However, we're also looking to assist the underemployed. And with that, I wanted to highlight a couple of events that are going to be occurring through our workforce department. The Elevate Men's Conference and our Elevate program, which is empowering lives through education, vocation assessment, training, and employment. Elevate will be, it's a program that will be in collaboration with Kenosha. They're going to be hosting a men's conference down at Carthage College, looking to help leadership, mentorship, and personal growth, empowering men, especially non-custodial fathers, to create stronger families, stronger community. As my friend and coworker Waleed would say, they're a very underserved and underheard population that have a lot of power once they are empowered in the community. We're also going to be working with community and community partners for a community job fair at Gateway Technical College in October. In the fall, we were working with Equus, who is a partner of ours, to seek about 100 job seekers, and with about 28 to 30 employers are anticipated to be at the job fair. And we're going to be hosting that at Gateway, the Racine campus. And then finally, for the underemployed, Generator and Microsoft are working together to upskill in 4 different areas, which are training tracks that are demanding. There are 40 available spots, and they're an office administration professional, IT fundamentals and customer service, project management, and data analytics. And that's going to be, that is starting next week, June 26th. So for that, we're helping to recruit the people for the training to help get the 40 seats occupied.
Question. Are you still recruiting for those positions?
I can't hear
Are
you.
you still recruiting for those seats?
Yes.
Okay.
Yes. And if you want, I can give you my contact information and we can discuss.
Yeah,
Okay.
for sure.
All right. I'll send you an email tomorrow, or I can leave you my cell phone.
Leave me your cell phone.
Got it.
Okay, thanks.
Any other questions or comments? Ignacio?
Okay, so a little bit of background, or I guess I should introduce myself. I should have done this in the beginning, but I'm a part of the Youth and Governance program, which seeks to give select youth in Racine County, the opportunity to sit in one of the 5 committee meetings that Racine County offers, to give them like experience in government and just to participate. My question is, could I also have your contact, because I was planning an event for male youth in the beginning of the year, and met like a few roadblocks with like DEI. I won't go too into it, but it kind of aligns similar to like the Elevate Men's Conference, but for male youth, more specifically male youth of color, And I wanted to like focus into like careers in government or health.
Sure.
So I just wanted to like
Yeah.
maybe network and make that
Yeah.
contact.
No problem.
Thank you.
Actually just spoke with, um, we think that it would be a good idea to send, just a brief, probably maybe this slide and, your contact, to the full county board.
Okay.
Yeah.
Sure.
Other questions or comments? Yes.
I do have a question also on the transportation, for the people interested in doing this. Does the county provide any type of transportation to this? So that they can, because in my line of work, transportation is huge, that they can't get there. They can't, I mean, if they could, I mean, I could employ 20 people tomorrow. But the thing is transportation. Do we have anything in the county that can move from the west or from the east to the west? Because I mean, we've kind of used up a lot of our resources of, like for me, it's young men from 20 to 35 is my ideal candidate. And these are jobs that pay 80 to $100,000 a year. And with
Kristen, do you have a comment on that? Transportation?
I'm sure. We don't have transportation in the county. That's a simple answer, unfortunately.
is this something we want to look at?
Certainly it would be something to discuss, with Hope and with county executive. I think it's a very valid point. It's not the first time we've heard this.
Yeah, we've had it previously and there have been times when it was in service where we had an east to west and west to east shuttle, but it wasn't utilized to the level that it needed to be to manage it forward.
And maybe a little bit more pushing or advertising or
Yeah.
anything that I could do, or
Sure.
you know, to get them so that they could have it. I mean, I've used folks from the Correctional Institute, and it's so ideal that they just come, they drop them off, pick them up.
Yeah.
Yeah.
Well, and we've had a grant in the past called Commute to Careers, which ran for several years that we worked with the state of Wisconsin for, and they just don't have that anymore. And transportation's expensive. And so that's one of those things that we did under our county executive Delagrave, we did continue that for a while. And then it just got to a point where it was too expensive to continue. However, I agree that I think that's something we'll put on our list to continue a conversation
It's a
on.
very important thing. And it, you know, and maybe there's some, if they utilize the transportation, that they, you know, kick back 5%. I mean, and
Right.
just to help fund it or whatever. I mean, that way there's responsibility for all the way around. So
Yep.
it's a thought.
Yeah.
Thank you.
Good idea, Mr. Neighbor. Ms. Hood?
Yeah, is this just something that we could take back to Equus to utilize some of their surplus so we're not kicking cash back to them every year?
Absolutely.
Yeah.
Yes.
And then we can try
We're
to,
having open discussions, but we can, yeah.
awesome. Thank you.
Thank you for raising the question that, you know, can generate some new solutions, so appreciate that. All right, thank you. So now I think we'll go back to our regular order. And item 6 was resolution by individual supervisors in support of the elimination of birth expense debts in Racine County child support cases and authorizing the cessation of efforts by the Office of Child Support Services to collect birth cost recovery debts. And our attorney and director of our services, Mr. Jeff Leggett is here. I think he'll begin unless it was Kristen. Okay. Thank you for being here, Jeff.
You're welcome. Thank you. So just to give some background on birth costs, that's something, so birth costs traditionally for a long time have been assessed at the time that paternity was established or child support was established. And it's to pay back Medicaid for the cost of birth when a mother is on Medicaid or Badger Care. at the time the child is born. The father is assessed birth costs. And when in 2025, when we were last doing it, it was about $1,400 for each birth. And 85% went back to the state to reimburse Medicaid, and 15% went to the county as kind of a collection incentive to collect the birth costs. This is something that has a decreasing number of states are doing it. Wisconsin is probably only one of about one or two states that still pursue birth costs. Michigan was doing it, and they stopped in 2025. And a growing number of counties in Wisconsin have stopped doing it. Most notably, are stopped assessing birth costs and collecting birth costs. Most notably, Milwaukee, Dane, and then several other counties such as Jefferson, La Crosse, St. Croix, Adams, possibly others. If you remember last year, the county board passed a resolution for us to stop assessing birth costs in new cases. And we stopped assessing birth costs as of the first of the year, as of the first of 2026. And the reason we did that, and the reason for the trend nationwide and statewide, is that no longer assessing birth costs kind of, eliminates the financial burden on fathers, so that they have more money to support their families, so that money that would go to reimburse the state and would also go to the county can go to the families. So this is money that, was going to reimburse the state and now could go to the families for child support. So when we did that last year, the resolution was to stop assessing birth costs, but there are still outstanding balances on a lot of cases, and we were and still are collecting those outstanding balances. So right now there are probably about 1,800 cases that still have outstanding birth cost balances, and that amounts to about $2 million. And the county share of that would be about $300,000. Now, many of those cases are, they're old cases. Some date back to the 90s, and so they're probably not collectible for the most part. Now, what Milwaukee did, so they got some help from the state in doing this, because it's hard just to, wipe out these balances. So what the state did for Milwaukee County, because they elected to wipe out the birth cost balances, and that was one of the concerns that we had, was that, we can stop assessing birth costs, but to wipe out these balances would be quite a workload. But what the state did for Milwaukee County was that they set up the KIDS system so that the balances would be expunged or zeroed out all at once. They sent a letter to all the participants stating that the birth cost balances were wiped out as of a certain date. So going forward, I mean, if the money already came in, it wasn't going to be refunded, but going forward, those balances would be wiped out. Now, Milwaukee County, they didn't file anything in the court cases. When we discussed this with our judges a few months ago, they wanted, just to make sure that the court record was clear, they wanted something filed in the court record, preferably a copy of the letter. We've been working with the state on that, and it's not, even though all these letters are going out to the participants, or would go out if we decided to do that, it's not an easy task, just from a technical standpoint, to get copies of these letters and file them in the court file. So they're not able to, retrieve these letters separately. that's something that we can still work with, because we would want this to be, if we were to do this, we wouldn't want it to be a huge workload on the part of child support. That would divert us from our mission of establishing fraternities and collecting child support. So that's one of the things that we would have to work out. So right now, we're still collecting. We had budgeted this year about $40,000 that we would collect as part of our 15%. And one thing that happened a few years ago is that, as you might know, child support gets match funding. So for every dollar we spend, we get 66% back from the state. And a few years ago, the feds ruled that birth costs were no longer matchable, so that, say, if you lost $42,000 in birth cost funding, it was only worth a third of what it used to be, so that you could replace that $42,000 with only $14,000 in county levy. You weren't really losing $42,000 because you could spend $14,000 in levy money and replace that. So birth costs aren't quite what they used to be. But so at this point, we've recovered a good amount, because most of that money comes early in the year because it comes through tax intercepts. So already in 2026, we've recovered a good amount of what we budgeted. So even if the county acted, there probably would be little, or there probably wouldn't be much of an impact in 2026. Moving forward, there'd be more of an impact. But as time went on, even if we were to keep collecting birth costs, the impact would go down. I mean, we wouldn't be collecting as much, because those balances would be disappearing anyway. So I'm happy to answer any other questions on that, but that's just some basic background on what the proposal is.
So this item comes to us because one of our committee members, Supervisor Coleman, has sponsored a resolution to do exactly what the agenda item states. And I believe Supervisor Coleman would like to speak to it for.
So how did it come about for the county to even remove it from the budget last year? How did all that come about?
Well, I mean, that's something that has been discussed for a while. I mean, again, it's been the trend, nationwide for a while. It's been kind of the trend in the state, within the state. There's been resolution or legislation proposed in the state to eliminate birth costs that hasn't gone through. There was a proposal, I believe, in 2025, and it did not pass. So it's all something that's been under a discussion for a while. And we decided to propose that again, because the trend in the child support program is moved away from welfare reimbursement, which is where the program was 40, 50 years ago, towards getting more money to the family. So that's why I think the impetus for no longer assessing birth costs.
Okay, I was sure hoping for a different answer, but let me speak to the constituents. Let me speak to my committee, and let me speak to my board. This has been a project that has been under works for 2 years. Okay. We had a committee that consisted of the men from Elevate, Waleed, Ben Carson. You had myself. You had Sarah Foss, and you also had Joyce Wallington, who all got together, had a meeting, and decided that it needed to change, which started with emails asking questions about how all of this needing the stats, which led into there was a study that we presented, and we actually ended up having communication with the people from the study, gaining insight into all of this, as well as having Milwaukee County's own supervisor, Carolyn Gomez, thank you, because these are all the people that help spearhead this. And as me being the elected official, I just made sure to push it forward. So I was hoping that there would be integrity with that. But I'm gonna leave my opinion out because it's not about my opinion, it's about what's good for the people. The reality about this is that a lot of non-custodial parents are not within their homes because of financial reasons. That's why it's important to try to do right by the men that are on child support of all race, color, and creed, who comply with child support, because a mother is forced to deal with child support because you get services from the county. So a woman has to comply with child support. That starts with the father. Ask me how I know, because I was that single mother. All of these services that we talk about, I know about them because I had them. Story it's not clear with me. Hence as to why my passion is here. If we're gonna do something, the reason that this is coming about is because when it was in the budget, it was just to remove collecting moving forward. But that's not what I asked for last year. But I was told not to make it political. And that's why it moved forward the way that it did. Because I believe in being transparent and honest fully. And I was hoping that I didn't have to go there. But we're here now. So that's how this resolution comes with my name on it. It comes with my name on it, along with the group of people who have met to do the groundwork to see that it comes to light. If we're saying that we're going to help our community, right? A return on investment wouldn't be important. The only reason that it's no longer important is because there's no compensation anymore. So let's be honest. We're trying to do something to really help the men be more engaged in their children's life instead of worrying about a financial strain. And I can actually speak to that as well too, being the single mother that I was. And it was all because of child support. So I speak from what I know. But here I am today trying to fight for the men so that they can be in their children's life. If we're going to do something, we need to do it at 110%, or we don't need to do it at all. Thank you guys for giving me a chance to speak on it truthfully. Thank you.
Thank you, Supervisor. And so just in terms of a practical, you did give us a reference of a UW study. The idea is the birth cost fee is a barrier to some men, so they kind of go away and don't provide anything.
Yes, and
But
that's the problem.
But what seems to be shown what seems to be shown is when that fee is removed, there is more participation in supporting the families.
And participating in child support and wanting to help and be a part of the life. But when it's always money, 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 go give me money or you can't see your child. Or then you have the county, pay your child support or you're gonna go to jail and you're gonna have a warrant, at which you're gonna further be taken away from your child. Because guess what? That's all a part that's assessed in a man that pays child support. So if a man is in jail, how can you go to work? Because you're in jail. And we have people that have felonies because of child support and things like that. Not doing good for the child. But if we can take some of that strain off of a man, and I just say a man, I don't care what color you are. And let's give these children a better chance. And I only say it because I know firsthand. That's why I'm so passionate about it. Because I didn't choose to get mad about it and, oh my God. No, I'm actually in a position now to actually try to help. So this is just from my trauma that now we can make things right. But we have to do it at 110%. We can't just give a little piece and that's enough for them. Either we're going to do it all at 110% or we don't need to do it at all. Because yeah, of course it's going to help the people moving forward. That's one less thing on their bill. But what about the men that sit there with those balances now? And that's a part of the reason why they still have a warrant, a child support warrant. It doesn't go away unless we pass this resolution to formally make it go away so that we can give men a step up in trying to be the best father that they can be, irregardless of the fact that they are not married. Who are we to judge anyone with everything that everybody does in this world? Who are we to look down on people because they weren't married? None of us are qualified to judge anyone because we all sin different. It's just a matter of people find out or not. So that's why we should not judge and talk about anyone. So we're going to leave out the fact that they're not married because it doesn't matter. We're talking about truly helping community. So either we're going to do it the right way, all the way, or we just wonder why we keep having the problems that we have within the world today. Enough is enough. True change starts with doing it all the way. And we have to know that what we used to do, it's not working anymore. That we need to move forward with new ideas. And it's okay for us to say, oh, we got it wrong. Let's go back to the drawing board. Let's start over. But we know that the old time way is not working with the unparalleled times that we're living in. And guess what? We get to help make this decision. Are we going to continue to be mediocre? Or are we going to move up and are we going to truly elevate? And that's where we get to help make this happen because we say that we care about community. Now we get to show it. Do we care or do we care about collecting money? Thank you.
Thank you, Supervisor Coleman. This is an action of the committee only, but certainly if any Human Services Board members have a question or a comment that you may speak. Not required, but I just want you to know that the floor is open to you. So Jeff, it seems that at least in Milwaukee County, there has been some success when this is removed. The child support has increased.
I believe so, yeah, and that was the reason, that I mentioned as to why we, certainly stopped assessing. And again, more money goes to the families, so that helps.
Okay. Any other questions or comments? So this has been referred to the committee, and Supervisor Coleman, did you want to make a motion in this?
I so move.
To,
Make a motion.
and you
To
would
move
like
it.
this sent to the county board?
I move to make a motion to move it to the July meeting
Okay,
to be able to allow all of our supervisors to read the proper information before making an informed decision.
Okay, is there a second?
Second.
There's a motion and a second to send this to the county board at the first meeting of July. Any further discussion? Supervisor Hopkins? No. Okay. So, all right, we have the motion. All in favor from first, Youth and Governance,
Aye.
County Supervisors?
Aye.
Aye. Any opposed? So that will be sent to the county board for the first meeting in July.
Thank you.
Okay. Thank you very much. Thank you,
you.
Jeff. All right, item 7. And 7 and 9 are actually linked. So I'll have, and this is actually just information for the board and the committee, but we are endeavoring to go to work to end homelessness in some new ways and some new collaboration, and I'll let Kristen explain.
Thank you, Mr. Chairman. So this is the continuum of care. We have brought this before several of you in the past. This is the formal memorandum of understanding to enter into Racine County as a collaborative applicant, which means we will enter into a planning phase with the Racine Homeless Alliance and the current Continuum of Care Board to begin the process of acceptance of the grant to be the COC lead in Racine County, which means we will continue to oversee the COC. It is made up of several different entities, nonprofits, volunteers, that looks at regular data and works together to not only seek additional funding, but also to work to end homelessness. And so that is going before the county board tomorrow. In addition, the ordinance along with it, which is number 9, the ordinance had to change to add this position because it is an added position. It will fall under the supportive services umbrella, which is an area that I oversee. It seems to fit within some of the work that you've heard about tonight. And so the ordinance was just not only adding the COC as a separate entity, but also noting that we won't be creating a separate department, that it will fold into work that we are already doing. Happy to answer further questions.
Any questions? And I think we're very hopeful that this will be a new era of collaboration and not only results, but I think the hope is that it'll enable us to get more grants.
Absolutely.
Supervisor Hopkins?
You've been very informed about this whole process. We're pretty familiar with what's being proposed, so just needs to move forward. Thank you.
Okay, if there are no further questions, we'll go to item 8, which again is information only, but this is a resolution that came from Finance and Human Resources about creating one full-time equivalent crisis supervisor effective the end of this month and some budget transfers.
So this resolution, we received information about crisis stabilization from the Department of Health Services. They are changing the billing in how we're able to bill for positions such as this, which means beginning in July, of 2026, we will be able to bill a daily rate as opposed to an hourly rate for individuals who are at sale. And they may be there for a few hours, they may be there for a day or a few days while they stabilize. This new billing allows us to bill whether they're there for 3 hours, 4 hours, a whole day, that we can bill for an entire day. Additionally, the need for a crisis supervisor, this is a 24/7 operation. We average 6.5 people, it sounds strange, but 6.5 people per day at sale. They have a variety of high needs, and someone at second shift to be able to supervise, to support workers, to work with individuals is something that is so necessary. And it not only will help the consumers that are utilizing sale, it supports our workers, but additionally, it keeps individuals out of the emergency department. It helps them transition back into independent living or into their family home much quicker. And so while this position would start in anticipated date of August, if this is accepted, and it would be 60% funded through billing throughout the remainder of 26, beginning in 2027, it would be fully funded.
It's always good to hear when a bureaucracy change helps us. Any questions on that one? All right, thank you. Now, based on what we did before, I think we're up to item 12, Meals on Wheels update.
So right now, there aren't any major changes to Meals on Wheels. There is no wait list, and we do not have deferred residents. So we are still seeing about 100 meals at congregant sites on the days that they're open. And then about 112 meals Angry Brothers has been serving in about an hour and a half on the days that they're open for lunch. So these sites are being utilized. We're seeing a lot of success in the congregate sites that are open. And we aren't seeing that wait list that we had mentioned a few months ago. So we're in a really good spot right now.
Well, again, we appreciate that you alerted us to the, the potential problems, but as in many times in the past, our Human Services Department has strategized ways to make the best out of any situation. So we appreciate that.
Absolutely.
Any questions? All right, item 13 is the opioid and overdose update, and I think there's a sheet in our packet on that.
Mhm. Yep, you should have the updated numbers. What we've seen in May, I will say I spoke to our public health officer. We're continuing to restock the machines with the xylazine strips and the fentanyl strips. There was a small spike alert last week. While that was not sent out to the community, I asked him about that, and that indicated that the emergency rooms were seeing individuals, a few more individuals than normal present. That doesn't mean that they were confirmed opioid users. That doesn't mean that we have information on what happened once they presented. However, that when they got to the emergency room, it appeared that there was some opioid use. And so what that data shows us is that we want to stay obviously hypervigilant on making sure those resources are available. The public health officer mentioned that was really a level 1 spike. And so that just means that they're monitoring the data, they are making sure resources are available, and they're not concerned enough to be moving on to a level 2 because the data isn't showing that right now. I also thought it was interesting that the machines, when if someone goes to get Narcan or fentanyl strips, there's an automatic survey attached to that. And what that's showing is about 13% of vending machine users are getting supplies for themselves. About 87% are getting them for someone else.
Hmm.
So that's data that can be used not only to just monitor placement of where these machines go. When they originally came out, we didn't know. And so put them where we thought the users would need them. And so it's just something that will continue to be monitored to see if there are better placements for them. And the data, I didn't realize that that's how those machines worked. It actually asks you how if you're getting a Coke, say, a Coca-Cola, you can pick, are you getting it for yourself? Or you can pick a Coca-Cola, are you getting it for someone else? And so you go to the, what works for you, and that's how they're collecting that data.
Interesting. Well, seems to me that says that a lot of people are looking out for friends or
people.
family. Yeah.
Mhm.
Yeah, without judging the fact that they're addicts, that
Mhm.
at least we can save your life.
I will tell you, I got a kit for both my children my daughter has graduated from college, but was in college, and whether for her or for a roommate or a friend, same for my son. And it was a no judgment, but I think it's something that, because you don't know.
Exactly. Chairman,
Yes.
just to go back to, because I had concerns about the Narcan machine
Mhm.
being at the John Bryant Center.
Mhm.
Um, being that we have one at the at the at the library and at the transport
Corey
for the
knows.
bus, right?
Mm.
So I think that it's time to bring that up again,
Mm.
because months have went by
Mhm.
and it's been crickets. So I think I need to move that to the table again.
Okay.
Yeah,
I will.
that we need to, because that's so close in the vicinity, within a matter of miles.
Mhm.
Mhm.
And I'm not talking 5 miles.
Mhm.
I'm talking literally 2 to 2 miles,
I have,
if that.
yeah, I haven't studied the usage. What is the usage telling us?
That's something that I will bring back to the public health officer, and he will have to reach out and in partnership with the city of Racine. So there are machines that are monitored by Racine County Public Health, and then machines that are monitored and put up by the City of Racine Public Health Department. So we'll have to reach out and work with them to determine the usage and have that discussion about placement.
Specifically because they are actually all city,
Yeah.
all 3 of them, and they just happen to be in my district.
Mhm.
Mhm.
Yeah.
So that's why it becomes so important,
Mm.
because when we look at what we have right in front of us, just with the stats and what the John Bryant Center, since that's my concern,
Mhm.
you have 5 in January, 6 in February, 7 in March, 4 in April, 5 in May.
Mhm.
And when you look at the totals, it's 156
Mhm.
when we look at everything. The thing about it is, having the vending machines is not a bad idea. But my argument has always been, you have it all in this one area, right? This one area, instead of having everything spaced out. That has always been my position.
Mhm.
That I'm not against having something that's going to save somebody's life, because we listen and we don't judge.
Mhm.
And let's save a life if we can. But
Should-
we also need to be reasonable
Mhm.
and
And
do things with the purpose and making things make sense. So
so as I understand it, your point is there a better place?
yeah, that we need to move. We know that the vending machine does not need to be at the John Bryant Center. It does not need to be there. The children, they play with it. They knock all of the Narcan and xylazine and everything down because they think that it's a game. It is not a place for a community center.
Hmm.
Especially when you close at what, 5?
Yeah.
How's it gonna help if it's inside the building?
Do you have any good contacts with the city?
I sure do.
Okay.
But I'm just putting it on record
Yeah, no.
because I've mentioned this and then I wanted to wait to see what was gonna happen. And then, but now it's time to bring it up again.
And there are, I mean, the stats show a real difference in usage.
Yeah, when you look at it's successful being at the transit center.
Mhm.
Like numbers don't lie. When we look at black and white, they don't lie. So we know where it's successful at,
It's just,
but we don't have to just flood one area.
Mhm.
right, thank you.
Thank you.
Supervisor Meyer.
Thank you, Chairman. Sitting on the Board of Health as a member, I can also pass that information on to Jeff. And I know that there's been conversation from Jeff in regards to the locations for the city, but the city also has the final say on where those machines go. So I can bring that forward at our next Board of Health meeting and bring that up again and see if that's something that they can revisit both entities and talk about where their locations are. Also, just recapping too, as far as the timeliness for some of these machines that are open, the one of the DMV is open the same type of business hours from 8 to 5, and that gets utilized the most out of all of them. So more times than not, if they're looking to get those resources, they'll find them when they're open. But
Thank you.
we'll revisit that and bring that up on behalf of the committee and the board.
Thank you.
Thank you very much. That's a good reason why we have these updates. All right, any other questions on that?
Just, I think a comment that I'm glad you pointed that out because there are huge gaps between that area, that small area, and like the north side of Racine, which has nothing, 3 Mile Road area. There's a lot of areas that can benefit probably from having something like that available to them. And there's just huge gaps. You're going way far east and way far west, and there's a lot in the middle. So thank you for,
Yeah.
let's give that some
'Cause I believe
consideration.
we're past the stigma, I would rather you save your life, no judgment. Whatever decisions we choose to make in our life, that's on us. There's consequences and repercussions behind everything we do. But since we're helping, at least let's help the right way.
Thank you very much. All right, I think we're at item 14. Did you have any other information for us, Kristen?
I do not.
Okay, did any members of the board or committee have any announcements or information you'd like to share? Very good meeting. Thanks for all the participation. I want to thank my colleague Supervisor Spencer for helping me with the meeting. And our next meeting is a very important one. I've mentioned this in the past, but we do have some new members. By state law, Human Services has a separate public hearing and initial budget draft presentation. So at that July 13th meeting, which is our next meeting, we will hear about the proposed 2027 budget plan. And then the public is invited to give input at this early date. So that's by state law. So that's coming attraction. Other than that, I need a motion first from the committee to adjourn. And a second. And from the board. And a second. Okay. For Kim, so Supervisor Coleman moved, Supervisor Hopkins seconded for the committee, and Brenda moved, and Andrew seconded for the board.
Thank you.
All in favor? We are adjourned. Thank you all.